Jacqueline Kagu, a mental health advocate in Kenya. And I want both parties to explain what they have in store for mental health in this country, given that in mental health, Ministry of Health has allocated 0.3% to mental health, which is very little compared to what is in store for in matters mental health. And given that Mental Health Amendment Act 2022 is almost being signed by the president of this country.
Sorry, Ken, I missed a little bit of what she said.
Issues of mental health.
Mental health, yes.
Yes.
We can't ignore that mental health is here with us. It's with our brothers, it's with our sisters. It's with people very close to us. And that's why I think the suggestion, one of the reasons, the suggestion to introduce, to regularize the growing of bang in our nation, that's why I'm opposed to that. And I know you'll be asking more about that question. Mental health is sort of, I personally have had people close to me who have suffered from that. And we need to start tackling that. We need to come up. We have said a lot about in our covenant, Agano na Kenya kuhusu afya, concerning health. In our hospitals, this is something we will want to give a lot of attention to. Number one, we need to start tracing it from as early as primary school, if not high school, because one of the problems we've had is ignoring that mental health is real and it exists. Number two, we need to come up with what other countries have done. And other countries have come with means and ways and means, where there are even lines where you can call because you feel like taking your life the next 1 minute, and you get a counselor ready waiting for you. We need to come up with places that the government has oversight over. Right now, I'm not sure, I can't say 100% that the government has oversight over rehabilitation. I was checking the other day and it was not clear to me who licenses or how they should be licensed. I mean, and right now it's at very high level with the problems that we have to come. We will give enough money to our health sector. We've talked about at least a 5-level hospital in every county. And in it, we will demand that there be established a Department of Mental Health.
How much is enough money?
You know what we've been saying? We have 12 covenants with Kenyans. And we are saying to them, you know what, before the end of our first year, we saw ourselves getting not less than 12 trillion back into this nation, more. And we have gone as much as saying, we are saying no to corruption, bring our money back, and we have even been had to say 1 trillion for every economic sector in Kenya. If we are not able to give 1 trillion, we are talking about half trillion. We have money in this nation. This is a wealthy nation.
Okay.
That's why we're able to lose 2 billion and we can't notice it. That's why 215 billion euro board is unaccounted for. It's nowhere. And nobody, the moment Auditor General Ouko left, and after a few months, it's a forgotten business. It's not forgotten. We want to know where the Euroboard money went to.
All right, at this point, I would like to shift focus to our next topic, and that is on the issue of education. If you assume office in the next few weeks, perhaps, your biggest headache in the education sector will be as early as January, when 2.5 million students will have to transition into secondary school. How are you going to address this crisis of congestion? Because already secondary schools are congested.